by
Please do not interrupt.
Oh, it's just about saving lives when you're talking about an agenda item. I'm sorry. It's just hard to take.
Arguments erupting in the Multnomah County board meeting today as one commissioner calls out the chair for how she's addressing the ambulance staffing crisis. This comes after months of mounting pressure from leaders all across the region to temporarily change Multnomah County's 2 paramedic requirements to 1 paramedic and 1 EMT during this national paramedic shortage.
Now we sent investigative reporter Elise Haas to ask the tough questions.
So today, Jessica Vega Pederson had a last-minute press conference, and that's where she really put forward her 4-point plan to address the delayed ambulance response times. And she continues to blame the ambulance company.
I won't be bullied into any kind of quick fix. And the truth is that AMR is failing our community.
Multnomah County Chair Jessica Vega Pederson is doubling down on her stance, emphasizing that American medical response must meet a contracted requirement of having 2 paramedics, despite a national shortage. She is urging AMR to subcontract employees, hire and retain more paramedics, or face fines upwards of $2 million.
I believe that AMR can take these action steps to improve their service.
Her 4-point plan to address the ambulance staffing crisis includes formal mediation with AMR, reopening the ambulance service plan 2 years early, reviewing the fire department services, and convening experts in the next 30 days.
What do you make of the city of Gresham and also Portland calling for this temporary change for half of the staff to go to 1-1? You say you're taking action right now, but you just said we're going to wait 30 days to convene people, take a look at the whole plan when ambulances aren't getting to people's emergencies right now.
So we're not going to wait 30 days. We are going to be convening the group and getting response within 30 days. In terms of Portland City Council and Gresham City Council's resolutions, I think we all share this sense of urgency about this situation. But I have significant concerns about the suggestion to use executive or political power to override clinical expertise and the decision-making authority of our emergency medical systems medical director.
Soon after this press conference ended, this issue spilled over into the Multnomah County board meeting. Commissioner Sharon Meieran critical of the fact that the board was discussing planting trees instead of the ambulance shortage.
That the emergency response is actually if heaven forbid anyone had to call an ambulance and was not able to get a response, this is probably more important on a actual emergency basis than anything that we are discussing in this boardroom today.
I will say for everyone to know, we have had a briefing on the ambulance service response plan for the 29th. That has been on the snapshot for a while. It has been planned. There are updates to board staff. There will be engagement with the county commission. And that is our chance to have that conversation. And that has been something that we have been planning for and engaging work in for several weeks now. So,
how many lives will be cost by
Please do not interrupt.
It's just about saving lives when you're talking about an agenda item. I'm sorry. It's just hard to take.
Commissioner Meieran, your time is done.
Ending in Commissioner Dr. Sharon Meieran walking out. So the chair's announcement comes right before Gresham and Portland City Councils are bringing up resolutions tonight and tomorrow morning to call on Multnomah County to switch to the 1 paramedic, 1 EMT model immediately. And unlike the AMR plan that was released last week, where the ambulance company stated how they can fix response times in 1 to 3 months if the county allowed for half of their ambulances to be staffed with 1 paramedic and 1 EMT, the county executive's plan contains no solutions to the current response time crisis nor any dates for solving it. So we asked the ambulance company for their response to today's surprise announcement.
For her to indicate she's going to enact fines because of our inaction is really disappointing. We've put everything we can into this, and we fought very hard to educate the chair, providing her all the data that is available, including all the national studies. We're very concerned that this is the direction of travel she's chosen.
Well, she's definitely taken this personally, which is, there's personal and there's business. You last week had a letter that was signed by numerous agents, including Portland Fire Department, saying, let's go to this model to save lives right now. Was she not swayed by that letter at all?
I mean, as you could hear, she said that she's sticking to her side and what she wants to do. She says she's going to meet with Gresham and Portland to talk about why they want to switch. But in the meantime, she hasn't put forward any solutions. It's, she keeps talking about meetings. She keeps talking about studies when we have national and local experts who are saying that, rapid response and rapid transport to the hospital are critical, especially for life-threatening emergencies. We're talking trauma, stroke, heart attack. And here we are 2 years later, still having a debate when we should be talking about how to take care of patients and how to save lives.
Yeah, and as Meieran said, talking about planting trees.
Planting trees.
Right.
Right. So here, she comes out and announces that she's yet again delaying this emergency.
Yeah, and this is life and death. If she had a family member and called an ambulance and it wasn't there on time and someone either got sicker or died, that would be an issue.
It should be.
Yeah.
Okay, We'll continue to follow that. Thank you, Elise. Hey, developing